I'm, I'm pleased to introduce Evan Foster. Evan is the clinical research coordinator at the Hull Ellis Concussion and Research Clinic, a part of the University Health Network. Evan has a master's of health science in translational research and has been involved in the coordination and conduct of qualitative research, observational studies, and clinical trials. He has a keen interest in care navigation and has been working with the Toronto ABI network over the last 2 years to lead the creation of the Toronto Concussion Navigator. Welcome, Evan.
Thanks, Sarah, for that lovely introduction. I'm going to share my screen and thank you, Bis, for the opportunity to present tonight. I'm looking forward to presenting some of the work that we've been doing over the past 2 years or so. Could I get a thumbs up just to make sure everybody can see my slides okay? Okay, perfect. All right, so like I said, my name is Evan Foster. I'm a research coordinator. That's kind of the lens I come to you all with today. And along with my colleagues at the Toronto ABI Network and the Neurotrauma Care Pathways, we were able to get some funding to put together the Toronto Concussion Navigator. So this was a tool that was launched back in February, and I'll explain kind of the evolution of it. And now we're looking to think about how this is going to grow. And so I'm going to talk about the Navigator, how to use it today, but I'm also going to kind of rely on the audience a little bit, and hopefully we can have somewhat of an interactive discussion towards the end of my time about where this goes in the future and kind of what the next steps look like, because there's some really interesting considerations and decisions that need to be made that we don't want to make on our own. And so would love to get the feedback from everybody here if you're willing to share. So just a quick, in terms of how today is going to work, I'll go through the background. We'll do a walkthrough of the tool itself, talk about the feedback that we've had to date, look at the objectives in our plan forward, and some of those key challenges that I mentioned in the expansion of our tool. So it's crazy to think, but there's 150,000 or more than 150,000 incidents of physician-diagnosed concussions that are reported annually in Ontario. There's many others that aren't reported by physicians, that aren't diagnosed by physicians, they go undiagnosed. But even of the large proportion that are diagnosed by physicians, many initially go unidentified when they first happen. And again, this group knows this better than most, and this causes individuals to seek care at various time points post-injury. There are lots of concussion clinics out there that exist, but few are publicly funded. Admission criteria can be quite complex, and sometimes the care is not necessarily always evidence-based. And so we launched the Toronto Concussion Navigator in February of 2024 as a user-friendly tool for patients, caregivers, and health practitioners to use to help them find and access publicly funded specialized concussion care in Toronto. I want to emphasize that public funded piece was very important for us. And so the clinics that we included had to provide OHIP funded care and have no obligation for a patient to pay out of pocket for any services that the clinic offers. So we had a lived experience committee that helped us create this tool. We did want to create it on our own. This was a 6-person lived experience committee. 5 of them were individuals with concussion themselves, and we had 1 caregiver of an individual with concussion. We conducted 3 90-minute sessions as a group. The first one happened prior to any development of the tool. It was really important for us that we didn't come with any biases or preconceived notions in terms of how this tool should be developed. So we came with our idea and we talked through with the lived experience committee how this should kind of come to life. And then between the first and second to third sessions, we kind of built the tool and then got feedback on that from our committee. And I just want to share a quote that was taken with permission, of course, from the member, that participating in the Concussion Care Navigation Tool Lived Experience Committee was so valuable. I felt like our input as a committee was listened to and incorporated, and that we all had a role in shaping the final outcome into something that will be user-friendly. After so many years navigating this healthcare system, it felt very validating to contribute something that I know will make a meaningful difference for people with concussions in the future. So without further ado, I'm going to show a walkthrough of kind of how the navigation tool works, the Toronto Concussion Navigator. For those who are able, we do have a QR code that will take you to the link here. And then what I will also do is I will just drop this link into the chat for those who want to access it there as well. So heading over to the tool. So this is the landing page you'll get to when you click on that link or go to the QR code. One thing that we were able to do is we wanted to build this with accessibility in mind. And so in the top corner, users are able to either increase or decrease the font size to ensure that they can read it and that the font is big enough. And so a couple of things. So this tool right now is meant to help individuals who are 18 years of age or older to find a clinic in Toronto that provides specialized concussion care. And we need four pieces of information from the individual with a concussion. So to use the tool, we need to know the date of injury, how the injury occurred, the age, and postal code. Because this tool is meant to identify clinics that offer specialized concussion care, all the clinics, or most of the clinics, if not all, require a formal concussion diagnosis. And so that means that, the emergency room, a walk-in clinic, or a family doctor would have to first diagnose somebody with a concussion and then refer them to one of the clinics listed in the tool. As I mentioned earlier, accessibility was really important to us. And so the clinics that are listed here provide an OHIP-funded consultation. So there's no cost to the patient, and there's no obligation for a patient to pay out of pocket for any services. Some clinics do offer massage or physio that, unfortunately, when it comes to concussion, do very frequently or all the time require either private pay insurance or out-of-pocket costs. Some of the clinics do offer that, but there's no obligation for you to access those services at the clinic. It's important that people answer questions honestly, because if incorrect answers may result in somebody getting a suggestion for a clinic they may not be eligible for. Of course, we recognize that not everybody may have the ability to fill this out on their own, and so we have put a number for the Toronto ABI network, and my colleagues there are more than happy to fill out this tool with people and then make sure that the recommendations get to them in the most accessible and friendly way. So without further ado, we'll start walking through the tool now. So we asked the first question, has the concussion been diagnosed before? Of course, if the answer is no, it's fine. People can continue to use the tool, but it's just, again, flagging that the formal concussion diagnosis will be needed. So before the referral can be sent, again, you'd have to go see a physician or a nurse practitioner for them to confirm the diagnosis that you may suspect and then make the referral. In this case, we'll say that, yes, it has been. We see here that how long ago was the injury. So depending on whether it's less than a year, 1 to 3 years, or more than 3 years, that dictates some of the eligibility. And whether or not they're kind of 1 to 3 or more than 3 years, the specific date's not needed. But if it's less than 12 months ago, we do need to know the exact date or as close as possible. And so in this case, for the example today, I'll say that the injury occurred on November 1st. We have to enter the age. It does help us with some distinguish here, so we'll put an age in there. And then how were you injured? So again, selecting the most accurate way to describe how the injury occurred. So there's 6 different options here. And what's important about some of these, the injury may not be exclusive to one category here. So if somebody slipped and fell while they were at work, they could pick while it was at work, or they could pick a fall. And so the instructions, the note at the bottom here just says that when deciding between 2 options, it's important to select the one that's just higher to the top of the list. So if somebody was injured, again, in that example at work, but they fell, they would select this while I was at work option. And we also need to know the postal code. So again, it's important that right now this is a Toronto specific tool. And so if somebody puts that they might be from outside the GTA with a postal code of L, or sorry, outside Toronto and more in the GTA, it says here that it appears the postal code is outside of Toronto. And now it doesn't exclude people from using the tool, but it just says that the clinics generally require the visit in person. And so just making people aware that even if they are outside of Toronto, they will have to come in person to the clinic to be seen at their first visit. But again, I will say in this case, the postal code will put M1. And this is,
I have a question.
yeah, please.
Um, does it distinguish between proper terms? So, for example, a layperson might call it a brain injury, a head injury, or whatever various terms there are. I found that because I thought it was considered a concussion, I did not get St. Michael's Hospital in my search engine. So that delayed my ability to find the right place to get care. So apparently they used the word head injury. I used the word concussion. So that only brought me to one hospital, which is Toronto Western, I think. And then I was
Okay.
waiting for about 6 months. And in the middle of my wait, I was getting worse symptoms. So I ended up going to the ER of St. Mike's. And because I was St. John Ambulance volunteer before, I knew that was one of the trauma hospitals. So I go, okay, must visit St. Mike's. And I did that. And that's when I got referred to their clinic, so to speak. And I go, oh, really? I did not know. And so I go, that's concerning that they were that specific in terms because most people don't say the right terms. They miss that in their search engine. So I just want to make sure it's captured into that net, so to speak, whatever term people tend to use. Some people might say TBI, some people might say some other terminology. Like you understand what I'm saying?
Absolutely, Kim. It's a great point
Hmm.
because not everybody used the same term, right? So concussion, mild traumatic brain injury, head injury, etc. It's a very good point. One thing that, with this tool specifically, it is specific to concussion.
Hmm.
Right now, it's not meant to find services for people with more moderate to severe brain injuries, as an example. I know
So
that's
sorry.
not
Okay.
necessarily what you're getting at as well, though. Sorry, go ahead.
Yeah, sorry. So for example, when you say concussion, do you mean 2 weeks period only?
No, so that's kind of what I was saying earlier. It's hard to kind of go back, but let me just see if I can start another example here.
You might want to
So
put that in back feature.
yeah. So I can just kind of show that walkthrough again. When you get to this second page here, it says, when did the injury occur? When were you injured? Okay.
Hmm.
And so this is where, so somebody who is more, 3 years post concussion, again, they could select this more than 36 months ago, and they would still walk through and see a clinic option. If they were less than 12 months, and again, if they're within that last year, they may put their injury happened way back in June, and they would still, again, be able to walk through and get to this final outcome, which would be a list of clinics that you'd be eligible for, given your own criteria. So if somebody
Okay.
is a day post injury or 4 years, they're going to find a concussion clinic that they'd be eligible for in this tool. We were very pleased that there were no there was no demographic group that was missed in terms of that where there'd be no clinic that they were eligible for.
Okay.
Now, Kim, you do bring up a really important point, and we do have this when we look at this list here. When you're looking through and you're working through to try to decide, what clinic should I go to, there is an approximate clinic wait time here. And so you'll notice that some of the clinics do have longer wait times than others. And so this is something that, as you're deciding between which of these 5 clinics that somebody may want to go to, this is something that an important consideration to factor into that.
One of the things I don't like about our healthcare system is it depends on the access point. So if you were a good navigator, you would just go to an ER, even though it's not an emergency, versus your family doctor, because that would be a very long wait. I go, that's not right. It should be based on when your injury happens, severity, and all that other stuff. But for Ontario Health, it's more like, where's your access point? And I go, that's not right. You know what
It's
I
a
mean?
it's a great point, Kim, and that's one thing. Again, it's we agree with you. I think it's saying that we wish this tool wasn't necessary because, in a way, if the system was easy to navigate, it wouldn't be. But we found that because there are 13 different concussion clinics that are included in this tool throughout Toronto. And so we had to, but each of those 13 clinics have different criteria. And so that's why, again, we created this tool to help people go, okay, here are, in this case, 5, sometimes it's 1 or 2, sometimes it's 8 or 9 different clinics that somebody may be eligible for their concussion. And none of most of the clinics in here don't require you to go to emerge. You can be referred to through your family doctor or through, a walking clinic or something like that. We only recommend people to go to Emerge when they're in the very acute stages of their concussion. They may not have been diagnosed yet with that. So, because again, you're right, we don't want people going to Emerge just to get a referral somewhere, but you are right to say that some of the clinics only accept referrals directly through the emergency departments.
Yeah, and the bad part was that I was deteriorating like within 4 weeks of waiting, and that was ridiculous. Because if someone had flagged the issue earlier to be like, "Hey, Kim, go to the ER," it wouldn't have degraded so badly.
Yeah, exactly.
It was
Exactly.
just
Which
very bad. Like it should not be so bad that you probably suffer a stroke and didn't realize that. Like it was just really bad.
Right, exactly. And so that's why we're trying to navigate people to the resources as fast as we can. But it's a great point.
Thank you.
So I'm going to, thanks, Kim. So I'm going to continue with the walkthrough. So we've kind of walked through the tool already. And so this is the feedback that we've had to date on the tool. We've had pretty positive feedback, I'd say, overall. So this was as of November 18th when I pulled this information. We've had almost 600 people access the tools in the 9 months since it launched. So it's about 65 people a month who have gone on the tool. And we've had a little over 400 people complete it and get to the recommendation stage, which is about 47 a month. In terms of who's using this, we find the average age is almost 42 years. The average time post-injury, which is quite interesting, is about 2.5 months post-injury. Again, that comes back to the point that Kim was making there, is that people aren't necessarily getting the care they need right after the injury. And so they're looking to seek more care about 2.5 months after their injury occurs. The most common mechanism is a motor vehicle collision, followed closely by a slip and fall. And we have an optional evaluation survey at the end, which I didn't show you in the walkthrough, but you'd kind of get to as you're going through. And we had 41 individuals complete that survey. 85 have said the tool is helpful, and 80% have found the info they needed. Generally, the feedback has come from folks outside of Toronto who are looking for services a bit closer to home, and have said, it'd be great for us to include some of those in this tool. And again, that's what we're looking to do now. So that brings me to the kind of our objectives, what we're doing now. So what we're working on now is to expand the Toronto Concussion Navigator so it becomes more like the Greater Toronto Area Concussion Navigator, or maybe eventually the Ontario Concussion Navigator. There are some really important challenges, and this is where I'm going to recruit some of the audience to talk about this. These are 5 challenges that we've identified in terms of expanding, is looking at the geographical distribution of the clinics. And as we get outside of Toronto, there's not going to be clinics that are close to everyone, including fee-for-service clinics. There are certainly private clinics out there that provide concussion care, and right now they're not included in this tool. So how would we incorporate them? How do we ensure that care is standardized? So no matter what clinic you go to, you're going to be getting the same level of best practice, evidence-based concussion care. As we look to expand, there are some data privacy and security considerations. Right now, all the data is anonymous. It's not linked back to you. But as we continue to expand this, there may be reasons to include some privacy and security features in there as well. And then also looking at funding. Of course, everything comes back to where the money is. And so how do we sustainably fund this tool and ensure that it continues to be up to date and accurate for the people that are using it? I'm sure there are others as well. So I'm going to focus on the first 3 as we kind of wrap up the section here before I open it up more to the audience. So this is a map of the geography of the clinics that are included right now. You'll see they're all based in Toronto, and specifically a lot of them are based really in that downtown core. We had 1 clinic in Scarborough and 1 that's a bit further in kind of North York area. But notably, there's not a lot in Scarborough outside of this 1 clinic. And there's nothing actually in Etobicoke, South Etobicoke, that was included in our tool. And of course, this is even within the city of Toronto. If we go even further out and we look at the map of Ontario, how are we going to provide care to people who live in a province that's so vast? And so as we, again, look to expand out and make this tool include a larger geographical range, how are we going to ensure that there are clinics for people in these remote areas? And so this is where this dilemma of this including a fee-for-service clinic comes in. And again, this is so when we have a fee-for-service clinic, and when I say a fee-for-service clinic, I mean somewhere where you may have to go pay to access care. You're either paying out of pocket or perhaps you're paying with your private insurance if you have access to that. And so while that does provide more options to people and does allow, generally a faster time to receive care, the wait lists tend to be a bit smaller at these types of clinics. It's not these clinics aren't accessible to people who cannot afford it. And, there's a bit harder to ensure that we're providing people are receiving best practice care at these clinics. I want to just go back to this example. I have an aunt who lives in Midland, Ontario, which is just about 2 hours north of the city. And I can almost guarantee there is no OHIP funded concussion clinic in that small a town. So if she were to get a concussion, well, should she go to access maybe the private clinic that exists in the town? Or do we not include that in our tool and she be forced to maybe come down to Toronto to find care? That again would be covered by OHIP. So it brings me to kind of the first question that I'd like to pose to the group for discussion. And please feel free to just chime in and we can kind of work with this idea. Should fee-for-service clinics be included? Should private clinics be included in this tool as it looks to expand? And if so, any ideas how to do that, keeping in mind equity and equitable care? I can't see everyone, so please feel free to jump in, and we can get the conversation going if anybody has any initial thoughts.
Um,
Um,
I'm somebody. Oh, go ahead.
no, go ahead. I was just gonna say that is there a button where people click on, yes, I want to include that in my search. Like you know what I mean? Like you know how when you even for TDC app, you're like to say what time of day you're going or returning, or you want to avoid this, like this much walking, or you know what I mean? Like no matter what app you have, they always have the feature for you to narrow down your searches. Kind of wonder if that's an option to maybe perhaps go through that way.
Great idea, Kim. Just taking notes here as well. Sorry, John, I know you jumped in.
Yeah, it was similar to Kim. I think you know, I'm coming at this. I'm American. I have clients in Toronto, but I'm American, and I do think it's important to if you do include the private clinics to have a way that's very clear to people, like visually, that which ones are public and which one, so that people know who don't have who want to use public, that's public. Because in the States, everything is very individual. And like, for example, when I look at California, it's very hard to sort of figure out what's public. It's very confusing. And for people with brain injuries, or sorry, post-concussion syndrome, that can be really hard to navigate. So it's something that's visually differentiates.
That's a very good idea.
Yeah.
Any other thoughts?
A question I want to raise is a very big one, which is if you choose fee for service, are you doing the legwork of filtering the legitimate clinics versus the scamming ones that claim that they are, dealing with head injury patients, for example? Because there are some
But
places that would say, yeah, we are charging an extra $50 per session compared to non-concussion type of physiotherapy, for example, right? And they say it's because we have this specialties, quote unquote, right? But then they don't. It's just so it's almost like greenwashing labels, like onto like like cleaning supplies and stuff like that, right? Like you wanna like, is there a way that you do the legwork and screen for legitimate clinics if you're going to include them in there?
so that was actually, Kim, you took the words right out of my mouth. I
Oh,
just switched the slides because I had my follow-up question to this was going to be what role do we have in ensuring the clinics that are included provide that best practice evidence-based care? What is our role? And so I might actually if it's okay, spin this around to you and the rest of the group here, you know, are we responsible for doing the work, doing the legwork and vetting these clinics, as you mentioned, Kim, or do we just simply list them and let others do that, make the decisions on their own?
I think it would be best practice to do the filtering for the um, patients because they have a hard time already navigating DLE. So if you can take that big task off their um, plate, that'd be great. So that they're not like, oh, thinking that's legitimate, and then go ahead, go to the clinic and find out, $1,000 later, oh, this is not legitimate. I'm not improving. Like that's not good either, right?
Yeah, for sure.
Um, it's, I've been at this for 10 years, and speaking from that experience, I could say the vetting the services would be invaluable. It is so hard for folks to um, navigate on their own and find proper care. And we know that there's some excellent clinics out there, and then, as Kim and I think many of us know, like some not so excellent. So uh, from a from that perspective, I would encourage you guys who are the experts, right, to sort of vet what is a good clinic compared to someone who, is dealing with concussion and new to this and obviously dealing with the cognitive fatigue of that injury.
That's great, Mary. Thanks for the feedback.
I also agree with what Kim and Mary said. I know that funding can be an issue sometimes in terms of your ability to put in the labor for this. And, I suggest if you can't do it or whatever you do decide that you just label it well, like these things we vetted and we said these are good clinics, these ones we didn't get to, these ones we did vet, didn't meet our standards, but I encourage you to be transparent if you do decide to list these things and don't get to it all.
That's a good idea, John, too, is having, different tiers if to say, this has been vetted, this hasn't, approach with caution or vet on your own.
Yeah.
Well, thank you to everyone for your feedback. That's been really helpful. I know we're a little after 7 o'clock here, and I had the first half an hour, so just want to be mindful of time. So thank you for the opportunity again. Thank you to the BIS team for the invite today. I just wanted to kind of post the tool at the end here and with the QR code and the link, and open it up for any questions that anyone in the audience has for me. If there's any questions about the tool or how to use the tool, I'd be happy to answer them now.
Can you give us a list of the clinics?
So it's a great question, Susan. So the way the tool is set up is so that you're only going to see, when you go through and use the tool, you'll only see the clinics that you'd be eligible for based on your own criteria. And the reason
how do we use the tool?
Yes, good question. So if you, let me just go back here. If you go to the link that I put in the chat, and I can drop it in there again, you'll end up to this page that I'm sharing here, and I'll just zoom in a little bit. And there is some information, I'll, in the interest of time, I won't read through it quickly again here. But as you go through, it's going to ask you about different information about your concussion. Has it been diagnosed? Yes or no? Again, you'd answer that question. Was the injury, when did the injury occur, right? And you're going to answer the question accordingly. How old are you, right? Please enter the age. And then how did the injury occur, right? Please select the most accurate way.
I understand that.
So as you go through this, you'll end up at the end getting to a list of the clinics that that you'd be eligible for. So just based on the pathway I showed here, there are only 2 listed. And the tool unfortunately doesn't allow you to just be referred automatically. What this gives you is the clinic website, and at the very bottom, the referral form for you to access to bring to your family doctor or bring to a walk-in clinic and have them refer you to that clinic based on what you've chosen here.
Can
So
we
that's
get
how you get,
the tool, the concussion tool?
like the link to this tool.
It's a link.
It's a link. Yeah, it's a
Okay,
website.
okay.
It's a website.
Thank you.
Sorry, I might have misunderstood, Susan. My apologies. Yes, the link that I just put in the Zoom chat is is how to get there. And I'll just go back to the slide here to this www.redcap.link/TO concussion navigation. That's the link. And you can also scan the QR code there.
Okay, thank you.
No problem. Thank you. Thanks for the question. Okay. Well, again, I just want to say thank you, Mary, and thank you to the BIS team for the invite. It was great to be able to share our work. And hopefully anybody here, if you need it, the tool's out there, and feel free to reach out to me with any other questions as well. Thanks again.
Thank you. Thank you very much.
Thank you so much, Evan. It's now my pleasure to introduce Ayushi Dhingra for our next session. Ayushi is a registered occupational therapist in good standing with the College of Occupational Therapists of Ontario. She is also a member of the Ontario Society of Occupational Therapists. She obtained her honors Bachelor of Science in Cell and Molecular Biology at the University of Toronto and later completed her Master's of Science in Occupational Therapy at McMaster University. Ayushi has over 8 years of experience working as an occupational therapist with a specific focus on working with the pediatric population and clients with acquired brain injury. She has extensive experience in completing assessments and forming unique treatment plans for both children and adults with concussion, developmental delays, mental health disorders, autism spectrum disorder, attention deficit hyperactive disorder, fine motor challenges, and sensory processing challenges. She is skilled at completing assessments of attendant care needs, home safety assessments, and functional capacity assessments. Ayushi has completed various evidence-based programs and courses to provide the best care for her clients, including Learning Without Tears, Brain Injury Family Intervention for Adults and Adolescents, and Goal Management Training.
Thanks so much, Sarah, for that introduction. Hi, everyone. I'm so happy to be here. I've been here before where I've delivered a similar talk on managing fatigue after a concussion. So I'm really happy to be back and maybe provide some more updated information since the last time I was here. So I'm just going to show my screen here so we can get started. And I want to leave enough time for questions after as well. So I'll try to get through this. Okay, here we go. So today we'll be talking about managing fatigue after concussion. I work at Palmer Wellness and Rehab, where I see a variety of clients and different age populations who are still dealing with a lot of persistent symptoms following their concussion, especially after motor vehicle accidents or falls. Oh, sorry, I was just looking at the chat, making sure it wasn't a question for me. Anyway, yeah, I've been working with clients post-concussion for over 8 years now, and I see a variety of clients, different age populations, different mechanisms of injury, mainly motor vehicle accidents and falls. And unfortunately, one of the most persistent symptoms that I see after a concussion, sometimes years down the line, is fatigue. So I'm really hoping I can give you guys some helpful strategies, some just practical tools that you can use, even if it's just one helpful tool that you can walk away from today to help start that process with managing your fatigue. That would be really great. And if there are any questions in the end, we can go through that. You could put it in the chat and we can kind of go through those together. So just to get started with what we're going to do. So I'm an occupational therapist, and I want to start with just giving a bit of background on what occupational therapy is, because I think a lot of the time, not many people understand what it is. Sometimes my own family still doesn't know exactly what I do. So I'll just briefly explain what occupational therapy is. Then we'll go into fatigue, kind of describing what is fatigue, because there is a difference between feeling fatigued and feeling tired. And then we'll specifically talk about what fatigue looks like after concussion. I'll also go over some typical activity patterns, specifically that crashing and burning cycle that I think a lot of you might have gone through. And it's just a very easy trap to fall into. And we'll talk about what's sort of the target goal and why we want to avoid that crashing and burning cycle. Then we'll specifically go into pacing and planning strategies. So from an OT perspective, this is one of the most effective tools that I use with my clients in order to manage fatigue. It's outside of my scope to speak on anything medical related. So I can't give any sort of advice on medications or like specific treatment modalities, but given my experience and just as an OT, I would specifically speak to strategies related to how you can sort of structure your day and implement different strategies to help manage your fatigue. And then we'll go through some next steps, some things you can get started off right away, right after this presentation even. And then if hopefully we'll have time, we will go through some questions. So occupational therapy, what it is, I want to first go through defining what occupation is. So it's defined as groups of activities and tasks of everyday life, named, organized, and given value and meaning by individuals and a culture. Occupation is everything people do to occupy themselves. So that's where the word or the term occupation comes from, and it includes looking after themselves. So that would be self-care activities, enjoying life, so leisure activities, contributing to the social and economic fabric of their communities, which would be in that productivity realm. So self-care activities would include things like getting dressed, showering, preparing, and eating a meal, personal hygiene and grooming tasks, all the things you need to be doing every day, essentially, to just take care of yourself. Leisure activities, these would include any sports or hobbies you might be engaging in, such as reading, watching TV or movies, gardening. Also social activities, that would be part of your leisure activities. And then productivity, what we look at as productivity is things like going to work, going to school, volunteer activities. So that's essentially how we define as an occupation. It's any activity, meaningful activity that you need to do or have to do that occupies your life. Now, in terms of occupational therapy specifically, it's a client-centered healthcare profession that employs a holistic and evidence-based approach to assess a person's abilities, evaluate their environment, and how they engage in their occupations to establish goals on how to increase their occupational performance. So the model that we look at is something that looks like this. So we look at how the person skills, the tasks, so the occupation itself, the task, and the environment in which that occupation is being performed, how they all come together to then result in some level of occupational performance. And that's what we're essentially assessing. So as an OT, I'll either, work on the person and develop certain skills, or work on the task itself. Maybe we have to simplify the task. Maybe we have to break it down a bit further, or we have to change up the task. Maybe we have to adapt the environment, all with the goal of helping the person with any sort of injury or disability increase their performance in that task. And we'll talk about how, we can use different strategies in each of those realms to help manage fatigue. So when it comes to fatigue, there is a difference between feeling fatigued and feeling tired. So feeling fatigued is when you have that overwhelming sense of physical or mental exhaustion. And versus tired is when you have that feeling of being ready to rest or sleep due to any sort of physical or mental exertion. With fatigue, it can be very persistent, such as the case, following a concussion, and it can interfere with your daily activities and quality of life. When you're feeling tired, usually it's, very temporary, and it can be relieved by rest or sleep. Now, someone with fatigue will often wake up feeling fatigued even after a good night's sleep. So even if you got that full 8 or 9 hours, you didn't wake up once, often you might still wake up feeling tired or not quite well rested. Versus someone who might be tired is tired. They'll have a good sleep and then they'll wake up pretty well rested. Now, fatigue after concussion, I'm just going to throw out some stats here. And I don't mean to alarm anyone with these stats. It's more so to give you information and maybe a bit of validation in case, you're still feeling fatigue, that persistent symptom years down the line. I don't know where everybody's at in their journey. But I just want to put these out there so you're not alone. This isn't just you. There are many people like this. And there's been, several research studies done on this. So fatigue is one of the most pervasive symptoms following a concussion, with 27.8% of individuals experiencing persistent fatigue at 3 months. Typically, those experiencing fatigue 3 months post-injury are likely to experience it beyond 6 months. And it can still be present up to 5 years post-injury as well. So as I had mentioned before, there are a lot of clients that I work with who are years down the line from their concussion, and they're still figuring out ways how to best manage their fatigue because it's been so persistent, and unfortunately becomes this sort of chronic thing that they have to deal with. And the best we can do, or the best at least that I can do working with them as an OT, is help to manage as best as possible with the strategies that we'll talk about today. The other thing to keep in mind, though, is there are several factors that we need to think about that might be contributing to ongoing fatigue or might be exacerbating your baseline fatigue. So things like your mood, if you have the diagnosis of depression or anxiety, that's likely, and you experience those symptoms. Part of that would be fatigue. There might be some side effects of medication that's contributing to that. Cognitive challenges can be contributing to your fatigue. If you have poor nutrition or you're not getting the right nutrients to kind of level things out, that might be further exacerbating your fatigue. Poor quality of sleep, hormones, and activity levels, and if you've been deconditioned. Oh, sorry to see you go, Kate. Yes, I know this is a lot. This is a lot of information. Which hormones, John is asking. So I'll have to double check on that. The reason I mentioned hormones is because there was a study I had just read recently where they were going through the risk factors of ongoing symptoms, or who is at the highest risk of developing ongoing symptoms post-concussion. And what they found was, so they had like several factors, and a lot of them are unfortunately out of our control. So if you're a woman, an adult woman who's had a history of anxiety or depression, that in itself puts you at a higher risk compared to, let's say, a man, even if that man has a history of anxiety and depression. And what they found was, so they were trying to figure out why does a woman specifically, why is she at a higher risk? And what they found was it has something to do with hormones. I think progesterone. I'm not confident in that, so don't quote me on that. But that's the reason I just mentioned hormones, because specifically it was coming from this study that came from, or that outlined that women are at a specifically are at a higher risk of developing post-concussion syndrome. Okay, so I wanted to put up this visual as well, just to give you kind of an idea of what a brain, if we were to put this metaphor that your brain is running on battery, how that is different for a person or for you before your brain injury versus now after your brain injury. So before your brain injury, when you were quote unquote healthy, in the morning, like we talked about, you would wake up well rested if you had a good sleep, and you would start off your day with a full battery. Versus after a brain injury, even if you did have a good sleep, there is a strong likelihood that you would wake up and your morning battery is only partly filled. And this is all you have to work with versus before when you had full charge. So this could be something you could also maybe try to explain to a loved one who who doesn't have a brain injury and is having trouble understanding why it's so hard for you to do the things that you used to be able to do. And it's because sometimes you're working at 3/4 of what they're working with, sometimes even half. And so that reserve is just
Sorry,
depleted.
will that ever get to the same one as before, the full one with the full charge?
It's hard to say. The longer you are from your date of injury, so the more months, the more years that you've gone by since the injury, and if you're still having fatigue symptoms, the less likelihood that you'll get to that full charge. There is room for progress to keep making some progress towards the full charge, but getting to that full charge, at least in my experience with the clients I've worked with, the further along they are in their recovery and they still haven't gotten to that full charge, the less likely that they will get there.
What would be like a definition of that full charge? Is that
So
like,
yeah, it honestly depends on, I guess, your baseline or where you were at before your injury. There are some people who maybe didn't start with a full charge and their normal was maybe starting off at 75% or 80%. It really is comparing yourself to, where you were at before.
so I guess it can be like if when you are working before and you go through the day, right? And then at night you
Yeah.
rest, the next morning you would do it again. Whereas now, well, we're not working and yet, but then we can go through our day. But the thing is, when you're working, you have a different energy
Yeah, you have different
consumption.
demands. Yeah. Yeah. So if before your injury you were able to wake up, do a full work day, come back home and still, make a meal and eat, that was sort of your typical functioning before your injury. And now, since the injury, if you haven't been able to go back to work full time, or maybe you can only handle part time, then you haven't returned back to where you were before the injury. Some people, they try their best to go back to full time and they just push themselves along, but then by the time they get home, they're just completely depleted and can barely cook a meal for themselves, or they just crash and burn, as we'll talk about later. Or they might even take days to recover and they have to take some time off work. So it's just this sort of ongoing cycle that unfortunately they go through, or
Yeah,
I'm sure a lot of you.
I guess in that case, maybe what you can do is take some load of work, right? Maybe do it
Yeah.
part time if you're just crashing and burning after
Yeah.
that, right?
Yeah,
Yeah,
so that would be kind of like following a modified work schedule if your employer, I mean, your employer should accommodate for that.
can I
And
add? Can I add?
yeah, of course.
Uh, for me, I use the example of my cup has overflowed. So, for example,
Yeah.
if people are trying to tell me something or they're trying to have a conversation with me, like the way I'm speaking with you right now, it's like
Mhm.
if I'm tapped out, it's like no more information. You cannot give me any more information. I cannot remember what you just told me, or I'm just so tired out. I can't even keep track of the conversation. I'm just out of it.
Mm,
Or that
yeah.
I'm just like zapped. It's like like this the most simplest task or things to do. I just can't do it because it's just I already went over the maximum. Like that's how I
Yeah.
know is too much. Like whereas in the past it's like you're almost like a teenager where you're like just full of energy and then you just burn it like a firecracker and then like whatever, right? And then you might take like
Yeah.
a half an hour break and then you're back at it again because you're just so full of energy. Now it's kind of like, okay, just doing something like going to a doctor's appointment. You're like, you need 3 days afterwards to recover because you just have
Mm,
it's almost like you are you run 40 kilometers, like a full marathon, 42 kilometers, and then they tell you to run like another 10 kilometers. You're like, nope, I cannot do it. I'm just so wiped out. I already
mm.
spent all that energy just to go from 1 kilometer to 42 kilometers. Like you tell me to do 5 more, I cannot do it. Like that's the feeling that you get when you know that you are fatigued kind of thing.
Yeah, that's a great example, or that's a great metaphor. I've used, yeah, different metaphors to kind of help describe what the brain might be going through. So the charge in the battery is one, the filling of the cup is another great one, Kim. So thanks for sharing that. And then there's another metaphor, which has to do
The
with,
spoon, the spoon theory.
oh yeah, there's a spoon theory as well. Kim, do you want to talk about that?
Oh, some days you will wake up with 100 spoons and certain tasks will take away a certain number of spoons. So eating breakfast and like making breakfast and eating breakfast might take away 10 spoons. So you have 90 spoons left for the rest of the day. Then you go
Yeah,
to work, you might use 20 spoons, and then doing a computer task might take 30 spoons, and then you're already like
yeah.
only 20 spoons left by the time you finish work.
Yeah, so spoon is it's almost like a currency. Then you only have such a limited amount, and different activities require different amount of spoons.
It's like a
The other,
carnival, like there, like certain rides have certain tickets that
yeah,
you'd give to the
tokens.
person, right? Yeah, like that.
Yeah, yeah. The other metaphor is also using gas, like if you know, with a car, they all come with a gas tank, unless of course it's like an electric vehicle. But after a concussion or after a brain injury, a lot of the time, if your car all of a sudden becomes like this huge gas guzzler where you're not even going 10 kilometers and you're using so much gas. Whereas before, you might have had more mileage on your car, or you were able to go a longer distance with the gas that you had. Um, so sometimes, you know, I explain it that way as well to clients, or it's just another way for clients to explain it to their loved ones who are having a hard time understanding. But this sort of battery charge is also another example. I'm just going to move on now.
It's kind of
Just a
like when you get your first smartphone, like when you take it out of the
Yeah.
box, it's like it holds the charge, and then a brain injury is almost like when you had your phone for 5 years, like you have to
Yeah,
keep on charging it for it to be 100%. It just keeps taking out energy
yeah,
so quickly, like kind of like
just
that.
a question.
yeah.
How do you can we improve and how do we improve this battery?
So that's what we'll talk about. I'm just gonna move forward, and I'll hopefully give you some strategies to help improve and increase that charge.
Alrighty.
Okay.
Sounds
So um, I just want to put this up here too because these are literal quotes that I've had clients tell me or at least share with me that these are similar like thoughts that they've had. Um, Leading to or explaining why they end up pushing themselves. Because a lot of the work that I try to do with them is try to slow down and pace themselves but then they end up pushing themselves. And a lot of the time, these are the types of answers they give me, which maybe some of you can relate to as well.
Mhm.
So I hear, I used to be able to do all this. I think, was it Ria or Kim mentioning, working at a full-time job before and not being able to do that now. And then because you were identified yourself so much from being able to do that, that you push yourself to keep doing it. But then you kind of overexert yourself and you hit that crash and burn cycle that again we'll talk about. Or I'll hear people say, well, people will think I'm lazy. I'm already not doing much, which
Mhm.
then kind of makes them want to do more because they want to prove to other people that they're doing fine or that they're not lazy.
And
Other people,
say these are a wrong mindset, and what should be the mindset then?
sorry.
And would you say that these are wrong mindset, or and if so, what are the right mindset then?
Yeah, so this kind of mindset, you have to kind of find that balance because I will talk about how there is a certain level of push that you still need to give yourself, but it's just finding that right balance, which is so hard to do.
Mhm.
Um, and even I struggle sometimes with clients on finding what that right balance is, finding what the right limit is, where you don't push yourself over that limit. I'm going to show you some visuals, hopefully, in just a bit to help you understand what I'm talking about.
Yeah, it's
Um,
hard. I guess it's hard to know the right balance. Where is it?
yeah,
You pushing yourself too much, or are you just doing a little?
ex
You
yeah, it's hard. So, Ria, if you just hang on for a bit, I'll show you some
sorry.
visuals. No, that's okay. You're asking really good questions. Um, and then the last one is this sort of extrinsic factor where you don't want to let other people down, right? Especially if you have kids, if you have a partner, and you kind of have to push yourself to not let them down. And sometimes it's out of your control, especially if you have kids, you kind of, have to do those things, and it's hard to slow down. So having said that, a lot of this thought process, ends up or forcing people or thinking like they have to push themselves. So what ends up happening is this. So I'm going to go through this graph. I don't know if people have seen this before. It's from the Parkwood Institute. They do an ABI program. And they put together these graphs to kind of give a visual of what your activity patterns might look like. So on the y-axis here is the intensity of your symptoms. And then on the x-axis here, we have basically just time going by. So how long you're spending in that activity or recovery phase. So at the bottom there, we have the green zone, which we would call the safe zone, because that's when you have practically, zero to minimal symptoms. And these are activities that aren't really triggering any symptoms. You can think of it as putting your brain on ice. Once we go above that, we're in the yellow zone, which is the stage where you might start feeling mild to moderate symptoms. Um, it's not quite severe, like it's when you get there, you're maybe a little uncomfortable, but it's still tolerable. And then we get up to the significant symptom zone or the red zone, which we would also call the danger zone. And Ria, yes, I will give my contact info at the end. Yeah, so significant symptoms, so the red or danger zone is at the top. So the way we want to look at this is basically the purple sort of wave line here, which is your activity pattern, is what I typically see with clients who tend to push themselves. So what happens is, maybe at the beginning of their day, they're feeling good or they're feeling like they have enough energy. So they start their day and maybe they have a lot of emails to answer on their laptop. So they get on their laptop, they start answering emails, and they move up. They start to feel symptoms. So now they're in the yellow zone and it's getting more and more moderate, but they keep going because, oh, I have like 10 more emails to answer. So then they just keep going, and then they end up in the red zone, in the significant symptoms zone. And they keep going until they reach the very top of just complete intolerance. They can't take it anymore. And at this point, they crash and they burn. They need maybe hours, days to recover. And depending on the activity, so they take that time to recover. They start to feel good again. So they go back to the emails maybe or some other work-related activity, and they keep climbing up and they keep going. They're on a deadline. They have to keep going, and same thing, crash and burn. So as you can see, that cycle just kind of continues where they just keep pushing themselves, and then when they crash and burn, take a long time to recover. So this is, when I say current activity pattern, this is just what I typically see with what clients are doing when I first meet them. Oops. This is just the graph explained. I think you guys are getting the slide, so you guys have an explanation for that if you ever want to go through it. But this is basically what I just explained out loud. What we want to aim for is this kind of activity pattern. So this is when you have persistent symptoms. So the idea is that you start your activity, and when you're in the safe zone, when you're in the green zone, and when you have minimal symptoms, you start your activity and you work your way up and you get to the mild, moderate symptom stage. And at that point, you're feeling the symptoms and it might be slightly uncomfortable, which is fine. And you keep going and you kind of stay there for a bit. And then you don't push yourself to the point that you get to the significant symptoms.
Mhm.
And at that point is when you would take a break. And we'll talk about what a break looks like, because there are proper rest breaks that you should be taking. But at that point, you would be taking a break. It would be maybe a short break, at which point you'll be able to kind of recharge and then go back up to that activity, get to that mild, moderate level stage, take a break, and you kind of keep following that pattern. Oops. I don't know what's happening. Give me 1 second. Oh dear. Maybe this would be a good time for everyone to take a break. Close your eyes. Everyone just close your eyes. Okay, I don't know what's happening. Okay, sorry. You can open your eyes. This is just explained again. So the goal is to gradually increase activity tolerance without significantly increasing symptoms or crossing the symptom threshold into the danger zone. So this is where planning and pacing of your activities comes in. And that's, what we'll talk about next. You basically need to find the right level of activity goal. And then as your symptoms are better controlled, you can gradually increase your activity level. The idea is that you want to stay below your significant symptom threshold. So you want to stay below that red danger zone. Now, Ria, this is where we, talk about pushing, but within your limits. You want to feel a bit uncomfortable and stay in that yellow zone, but you don't want to push yourself so much that you get into the significant level stage. And a lot of that is trial and error. There's no exact science to it.
Yeah, good thing is you have to discover what are the signs and symptoms you're there, right? And sometimes that
Yeah,
be difficult.
it's very difficult, especially when, as we talked about, there's so many other factors that lead to your fatigue, right? Maybe you're having a really bad day mood-wise, or maybe the side effects are kicking in for your medication, or maybe there's a very stressful event you're going through. And so every day is truly different. Sometimes every hour is different. But the better you can try to get into some kind of routine, which is another sort of strategy we'll talk about. The more predictable you can try to make your day in terms of activities, the better
Right.
you can try to
Yep.
manage those symptoms.
That's true because I'm doing my routines now, and
Yeah,
it's because I'm comfortable.
yeah.
I wanna know how to take my step up
Mm-hmm.
as well. Physically, I'm doing my 30 minutes exercise treadmill, and that's my that's that's a normal thing for me. But if I go out and play um ball, what do you call that? Um pickleball.
Ball? Oh,
Pickleball.
pickleball, yeah.
Yeah,
Mhm.
pickleball. When I go home, I'm gonna be very tired, and I need to rest for a couple of days. So
Yeah,
that's I guess my red zone there.
yeah, yeah. So
I'm trying to figure out though where's my normal and red zone, the me in the middle.
yeah, so it sounds like, I mean, I think for a lot of people after concussion, you kind of have to find your new normal in a sense. Like what your tolerance, because your tolerances have changed, your threshold has changed, and we need to kind of try to honor that as much as possible so that you can still do the things that you want to do and need to do. But it's hard. It's definitely hard. But over time, this is essentially what the long-term activity goal is. So the goal is to increase that threshold. The goal is to increase, that tolerance of symptoms, and tolerance of like how long you're engaging in that activity before you get into the red zone. So again, this is where using strategies to plan and pace your day will help you reach this long-term goal, where you can then engage in activities for longer periods of time without making your symptoms significantly worse, and then also eliminating the need for this long recovery time.
Mhm.
Um,
I guess I guess volunteering comes in here, right? Like if my
mm,
goal is to go back to work, then maybe I can try to do volunteer, which is only couple of hours, and then several days,
yeah.
right?
Yeah, and that's a good goal and a way of kind of gauging how long your tolerance can be for then eventual return to work, or like return to part-time or full-time work. I'm just noticing Maria mentioned, I noticed that also relates to cycle. Definitely a good point to make. In fact, that research study that mentioned the women who are at higher risk of prolonged symptoms, one of the things, interestingly enough, they found was that depending on where you were at in your menstrual cycle, on the day of your injury, that can affect how, or what sort of risk level you're at with having prolonged symptoms. Um, so again, I wish I could remember, because that's kind of the main thing to know, which is, well, what is the risk factor with what stage you'd be at in the menstrual cycle, which I can't remember right now. I'm sorry. But I can pass that along once I find it.
I
But
I
it
also
was,
Believe
I
you.
I also noticed that I keep forgetting to pace myself. Like you're supposed to take
mm,
micro breaks every
yeah,
20, 30 minutes, that kind of
yeah,
thing. No
yeah,
wonder why I'm getting the horrible headache, migraine kind of thing, right?
yeah,
And then I'm
yeah.
also not even doing like things like stretches and
Mm,
um a bunch of other things. Oh, the blue light screen filter. What I realized was
mm,
when I didn't have it for a couple of weeks, I had terrible migraines. So apparently I still need them
mm.
as
Okay.
as accommodation at work. So I was like, oh,
Yeah,
oops.
that's a good observation you made though, and like good self-awareness that you were able to see that that helps.
Yeah.
Um, okay, we're just gonna move along because I really want to give you guys some tools and some strategies to help you. So when we talk about pacing, what pacing is, it's the concept of pausing or breaking up activities so that you're not doing too much in one day or in a period of time. Now, as an OT, the way we implement pacing strategies is at different levels. So at the person level, at the occupation level, at the environment level. And what I mean by that is, so at the person level, for example, I would work with the person on incorporating those rest breaks, as Kim mentioned, like those micro breaks. And again, we'll talk about what that looks like. At the occupation level, what that looks like is simplifying, switching, and planning out tasks in a way that you're still pacing yourself and you're not overdoing it. And then in terms of the environment, the main strategy there is really, in terms of adapting the environment, is reducing stimuli. So, occupational therapy would target all those areas to then hopefully help increase your performance. So when it comes to resting, it's important, as Kim mentioned, to schedule. You really, really need to just use a timer. That's kind of one of the biggest strategies I use with clients and really try to get them in the habit of using. And you want to schedule a break depending on your tolerance. So if some symptoms come on after 20 minutes on the computer, set a timer for maybe 15 minutes to do computer work, then switch up the activity or take a break. The other thing you can try is the Pomodoro technique. I don't know if people are familiar with that. It's just this structured way of taking breaks, which kind of looks like this. So the first thing you would do is decide on the task that you need to do. So maybe, let's say it's a cognitively demanding task. Let's like writing up a report. You want to set the timer to, let's say, 25 minutes. It doesn't have to be 25 minutes. Maybe you decided for yourself you can only do 15 or 20 minutes. So you set that timer. You work on the task until the timer rings, and then you take a short break, typically 5 minutes. So even if you were working 15, 20 minutes, still set that timer for 5 minutes. And then after 4 cycles of this, so you would do this 4 times, you would then take a longer break for about maybe 15, 30 minutes. So this is just kind of a structured way of implementing breaks, especially if you're working on a task that might take some time, like writing a report, or maybe you have, 20 emails that you want to send out. So this is a way of kind of breaking it down for you, but still implementing those breaks. Now, when I say rest break, what does that mean? What is a proper brain rest? So these are examples that would be considered proper brain rest. So listening to a podcast or an audiobook or music, a meditation session, going for a light walk, doing some gentle yoga. And by that, I mean like actual gentle yoga, nothing too extraneous. Any leisure activity that relaxes you and isn't too cognitively demanding. So something even repetitive like knitting, where you don't have to think much, and maybe you find it relaxing as well. And sleep or taking a nap or even just lying down is also considered a brain rest, but just make sure, you're not sleeping the whole day. You want to try to limit your naps to 30 minutes because you still want to try to follow a good sleep hygiene where then, you're getting, you're able to fall asleep later at night. Now, those were brain resting activities. There are, going back to our battery analogy, there are also some battery draining activities that you want to try to avoid. So visually stimulating activities like watching TV, using the computer, or reading are more battery draining than something like listening to an audiobook. So if you want to read something, you should opt to listen to the audio version of it. versus reading it, because it is more draining on the brain. Another draining activity would be going to a busy environment, especially when it's bright or colorful, like a grocery store, which I'm sure a lot of you have experienced, in terms of feeling very fatigued after even just a quick grocery run. Driving is also a battery draining activity. Any cognitive skills involved with driving. You're multitasking, you're processing all these different visual stimuli. There's you know, a lot of safety decisions you have to be making on the go. So driving is a very draining activity that you want to avoid. By avoid, I mean it shouldn't be part of your rest. These are activities that are not considered rest activities. And that cognitively demanding tasks should also be avoided during your rest. So again, reading, filling out forms, planning events. Again, with filling out forms, you know, I know sometimes if you're going for an appointment, you have all these intake questionnaires or all of that, and they can be demanding. So again, you don't want to be using your rest time to be filling out forms. And then finally, having stressful and heavy conversations, especially with a loved one, or sometimes you're on the phone with an insurance provider, or talking about your injuries, those can be very stressful. So you want to try to avoid those types of conversations too. And sometimes really any conversation can be draining, depending on, you know, who you're talking to or what you're talking about. The other, so we talked about, you know, what constitutes as a rest break, and how you want to try to get in the habit of implementing those rest breaks. The other strategy you want to try is simplifying or switching between tasks. So by that, I mean, try simplifying a larger task into smaller tasks spread out over time. And this all, of course, depends on the task, it depends on your tolerance. So for example, if you vacuum every week, maybe split that up where you vacuum your bedroom one day and you vacuum your kitchen another day, etc., and like spread it out over the week. Or if you know, decided you need to organize your closet, spread that over 5 days and, you know, designate a day for a different part of your closet. Filling out forms, again, maybe that can be very demanding. And so maybe you want to just complete 1 page per day or a page every hour, or every few hours, depending on the demands of it. The other thing you want to try is switching between tasks. And this can help you just get more done throughout the day without depleting too much, depending on the demand of the task. So this would involve switching between, you know, a physical and simple task like doing the dishes to then doing a more cognitive task like sending out emails. And that way you can, you know, still get both done, but you were able to charge a bit more with that cognitive brain, before jumping into it. Then the other strategy you want to implement is planning out your activities. So for this, I highly recommend people to use an agenda to help plan out your weeks, and prioritize and schedule the activities that you need to do. So when you think about it, there are certain daily activities that you need to do, like getting showered, getting dressed, eating, getting the mail. So figuring out, you know, what's your routine with that? Are you going to showering and get dressed first thing in the morning? And that's something you want to slot into your weekly planner. What are some weekly tasks that you kind of absolutely need to do, like taking out the garbage or doing your laundry, meal prep maybe. Maybe you have a weekly rehab appointment that you need to go to. Maybe you fill out a medication dosette for the week or doing your groceries. Figure out what day of the week is best for doing each of those tasks. And then some are maybe monthly tasks like paying the bills or going for medication refills. So figuring out, you know, which part of the month is you need to be doing that. And then there are other activities that maybe are happening a bit more infrequently, like specialist appointments or, social events. So you want to plan and organize your day to make sure you're doing your chores or work during times you feel rested and have the most energy. If you have more energy in the morning, then try doing the hardest task at that time. And then you also want to kind of think about your week and consider spreading out heavier or harder tasks out over the week. So that goes back to what we talked about before in terms of simplifying the task. So, you know, this is an example of a kind of weekly planner you can use to schedule in your daily and weekly activities. And it'll also just give you a visual of how your week is looking right in front of you. And you can try to maybe move things around if you feel like one day is looking a bit too full, depending on, the demands of the task and the things that you need to get done. Then the other strategy is adapting the environment. So this is a matter of really just reducing the stimuli and distractors as much as possible, especially when completing a cognitively demanding task. So you want to turn off the radio or the TV in the background, maybe try wearing noise canceling headphones or earphones. That way there's less filtering required from the brain, which then just decreases the load. You want to maybe also try just putting frequently used items throughout the day that in the same spot every day, like keys on a table, your glasses in a specific drawer, phone charger at a specific outlet, or maybe have multiple phone chargers throughout your home. Again, this is just a simple way of reducing the cognitive load when you're trying to find things.
I have a question about versus like what's it called? Sorry, let me reframe myself. What's the
Yeah.
difference between reducing the stimuli so you're not overstimulated versus it being harmful in the sense that you're not um, having exposure so that your brain gets used to the stimuli so it's not so triggered? Like, how do we tell the
Oh, like
difference?
gradual, like, are you talking about maybe having some gradual exposure so that you can build
Yeah,
your
versus like
tolerance?
just cutting it out completely so you don't have so much
Yeah.
cognitive fatigue.
So
Like I can't tell the difference. I'm trying, but it's really
I
hard.
know, again, yeah, it is very hard. You can like start with, let's say, with noise, you can start with maybe just having white noise in the background so that there's still that noise coming in, but it's not as hard to filter out versus like having a TV or radio. And once there are steps to it, especially with audio, there's like a hierarchy that you should follow in terms of trying to build your tolerance over time. So at the bottom is or like the easiest to filter out is white noise or brown noise, and then you kind of work your way up as you build
Like,
your
like, like,
tolerance.
like for example, when I had a non-scheduled ER visit on Friday, which took 5 hours, by
Oh
the way. I was like, oh my
no.
God. The lights
Yeah,
was killing me. And instead of saying,
yeah,
Kim, you can try to slowly expose yourself, I was like, oh hell no. I just wore my sunglasses
yeah,
that I had fit over my prescription glasses because I was just like,
yeah.
it's just giving me a pounding headache. It wasn't getting any better. So I go, this is clearly a bit too much. Like even though in grocery stores you usually go what a couple of hours and it's fine, but I was just
Yeah.
like it's just like maybe just the noise of the hospital and also the bright lights and then the stress of waiting was too
Mm,
much or something.
yeah.
Yeah.
I think, yeah, you have to assess what kind of environment you're in, what context you're dealing with. So for like in your case, you're in the ER, you're dealing with a stressful environment. That's not a good time to test your systems, maybe. Like it's probably not a good time to try to expose yourself. Like in those instances, you do want to reduce the stimuli as much as possible. Um, Whereas gradual exposure, you want to do that in more of a controlled environment or try that more in a controlled, less stressful environment and gradually build your tolerance over time that way.
Yeah. Okay.
Does that make sense?
Yeah, like when it's like an unknown environment or it's like
Yeah.
highly stressful, then just use your
Hmm.
assistive devices to manage the stimuli.
Yeah.
But If it's something where it's in a controlled room, then you can kind of be like, okay, I'll have music for a couple of hours and then give my brain a rest and then
Yeah.
do it like that kind of thing.
Yeah. And again, like factors, there's always so many conflicting factors. It's hard to keep track of what's working and what's not.
Yeah, I was told to wear hearing aids and then wear
Mm,
my prescription glasses so it reduces the cognitive load. And then every time I'm
mm,
thinking of the word, don't forget, put it into my phone. That way I don't forget because it's
yeah.
like your memory just is not there anymore and it's just
Yeah.
forces your brain to use its brain power. So yeah, just different tricks kind of thing to adapt.
Hmm.
You
The other
see,
thing,
you have
sorry?
given us several strategies to do this, right? It includes the planning, adapting
Yeah.
environment, and what are the other two?
Simplifying and switching between tasks.
Simplify,
Um, mhm. And then the most important one really is incorporating regular rest breaks throughout your day.
rest. Okay.
Yeah.
Oh,
Um, Sorry guys, I'm running into that same issue where I can't find my mouse and I can't go to the next slide. But there was just this last one in terms of adapting the environment, which is incorporating visual cues throughout your home to encourage rest breaks throughout the day. Because sometimes you don't put that timer on and you're just, in the middle of your activity and you look up and you see this post-it to take a break. And sometimes that goes a long way in terms of reminding you to take that break if you forgot to take or put the timer on.
In theory, I have that program on my work computer to remind
Uh,
me to take breaks, but I keep forgetting to
mm,
turn it on.
oh, you should put like an actual post-it note or something.
But
Oh,
we work from home, like it's a
yeah,
hybrid thing, and so it's like
yeah.
first challenge is you have a laptop. So if you put sticky notes on your laptop and then you close it, it doesn't
Mm,
make sense. And then plus you have to carry
mm,
it back and forth between office and home. And then we also
mm,
cannot put anything into a table or workstation because it's like hoteling. We don't have our own
mm,
station. We have to keep booking it like we're going to a hotel or
mm.
something and then reserve that space,
Yeah,
which is ridiculous. But yeah. So
yeah,
that's
that's
where the
hard.
challenge is.
Yeah. Um, okay. I want to lay out exactly what I want you all to try to do, maybe tomorrow. So the first thing I want everyone to try to do is get an agenda, either a physical book or you can use your smartphone, but ideally try to use an actual planner. Um, I want you to try to reflect on what your triggers are and what your symptoms are throughout the day and use this information to help plan out your days using the strategies that we talked about. And then using the planner, you start planning out your week and schedule those daily activities, those weekly activities accordingly. So like we said, give yourself a routine to follow and then plan it out appropriately. So, for example, if you have a long drive for an appointment one day, make sure you're not scheduling any other sort of cognitively demanding tasks that day. I guess this depends on your tolerance, the demands of the activity. Um, you'll probably have to add tasks and appointments as they come up, but as you have everything laid out and you have it there visually, hopefully you can use that to add those tasks and appointments in the appropriate slot, depending on what you have going on the rest of the day. And then I also want you to make a list of what you can do during your rest breaks. So we went through some examples of what a rest break can look like. Make a list of the things that are most appropriate for you. And then from that list, schedule your rest breaks in your planner, in your agenda. And then every morning, check your agenda to see what you have going on that day. You might have to make changes because at the end of the day, your energy is variable and can change day by day. It's okay to change things up in your schedule as you go along because, as we said, so many factors can pop up and it can be sometimes hard to predict. But as long as you try to stick to a routine, the easier it'll be to manage and predict how you're going to feel. some next steps for tomorrow. What should be your actual next step as soon as you get off from this is to take a break, because this was long. I don't know if people stepped away at some point, but truly take a break after this. And if I can give a recommendation, oh no, you guys, it's happening again.
So are we getting a copy of your slides?
I think so. Mary, is that right?
Yes, yes.
Okay.
Yeah, we'll be sending the
Oh,
resources out shortly.
okay. Oh no, you guys, I really want this to work. Oh, God.
Maybe we start it?
It's being very,
Sometimes if you go to Control Alt Delete, close the thing, and then
nah,
relaunch it, it sometimes does fix it.
I know that's what I'm trying to do, Kim, but it's just not working. Oh,
There.
where? What? Oh,
It moved.
did
It
it?
just
Oh,
expanded. What should your
no.
actual next step?
Well, okay, no, your actual next step is take a break, but I wanted to give you guys an example of a tool that I've used. Maybe if you can look it up, it's called Simple Habit, because I'm also having a hard time getting to the meeting chat to type it in there. Oh, okay, here we go.
There you go.
Okay, so this is a tool that I think might be helpful for a lot of you, that just something practical you can walk away with. It's it's called Simple Habit. It's a meditation tool. It's one of the few free ones that like you can still access, because I'm always on the search for those things. And the reason I like this one so much, and the way, and a lot of my clients really like it too, is because it has meditations and mindfulness sessions that are geared towards specific times of your day or specific circumstances that you're going through. So you would, click on the time of day, or maybe it's after work, or maybe it's during work and you're just wanting to take a break. You would click on that section, and then it would put together a mindfulness session for you, geared towards that circumstance. And it would be either 5 minutes or 10 minutes, or I think 15 or 20 minutes. So it's in different increments, and you can choose how long you want it to be. Yes, it is an app. So it's both for Android and iPhones. So I strongly recommend you guys check this out. In fact, if you have time, you can download it tonight and use it and see how you think, or feel with it. Yes, it is free. There is, as so many apps, like a premium version that gives you access to other, mindfulness sessions. But this one's good because they're pretty generous with what they give for free. I'll just put it here. If you go to that website, you can download it from there. And that was it. Sorry, guys. I know we went a bit over, but that is my contact over there. If you want to reach me, or if you have any questions, Mary, I'll send you these slides so you can send them out as well.
Are you
You,
OHIP covered, or is it private insurance?
Yeah, it would be private insurance. Unfortunately, I'm not OHIP covered.
Where do you practice?
I'm mobile, as in I do home visits or
Oh,
virtual visits. Yeah,
that's perfect.
yeah.
You have your contact here. This is your email, right?
Yeah, you can just send me an email. I can put it in the chat as well if that's easier. But it was so lovely to meet you guys. And Mary, thanks for organizing this. Let me stop sharing this.
thank you
I
so
hope that
much for
was
coming.
helpful. Yeah.
Thank you very much. That was a great session, and I love a free app. Doesn't love a free app, right? So
Yeah, I know. That's why I'm so excited to show you guys.
yeah, and some great actionable things that we learned today. So thank you very
What
much
is the
for
name?
closing off our.
What is the name of the app? What is the name of the app?
It's called Simple Habit.
Okay,
Hmm.
thank you.
Yeah, give it a go.
Very great. Well, thank you very much, everyone, for joining us for our concussion series. We will have the recordings available to the participants, and yeah, thank you
Is this
again.
is this our last session?
For this series, it is. Yeah, it went by quickly, didn't it? 4 weeks.
I
Yeah.
was only able to attend 3.
Hmm.
And the one that I couldn't attend, it was not recorded. Oh, that sucks. Because to be fair, I went to the cardiology and he took so long. I think I finished at 6 something in the evening. That's how backlogged he was. So yeah.
Ooh.
Yeah. So I got home pretty late that night, actually 10 or something p.m. 9 or 10, I can't remember. But yeah, it was pretty late. And it was raining.
Well, yes, so thank you for coming, everyone, and joining us for this series. Apologies for not getting the packages out of all the slides and the videos. We're just waiting on Center to provide some resources, but we will get them to everyone as soon as possible. And Ayushi and
it was a
Evan
good
again.
series. It was a good series.
Yeah. Will it be
Oh,
run
great.
again in the
Yeah.
future, like any other series or
Yes.
repeat?
We run this concussion series every year, but we also are planning on running other similar series like this. They'll be like more about brain injury, but we all know they're like, very similar and related coming in the new year. So
Yeah, I'd
stay
like to
Okay.
sign
tuned.
up for them.
That's hopeful.
Yeah. Great. Amazing. Thank you, everyone, for coming.
Thank you.
Thank you.
Bye.
Thank you very much.
Thank you.
Thank you. Have a good night.
Good night.
Yes. Bye.